Good evening and welcome to blackdoctor.org. I'm your host this evening, Shamika Rhymes. Let me know in the chat how you're doing and where you're watching from. This is such an important topic, but I'm going to get to that in just a second. I want to make sure that if you guys have questions tonight, we want to answer those. So please drop that in the chat. And remember to share this with your network because you never know who, on your friends list, someone in your circle who may need it. So please share this. And so March is Endometriosis Awareness Month, which is why I'm wearing yellow. And tonight we're diving into, if you saw the title, it is Endometriosis in Black Women from Awareness to Advocacy. We're here to shed light on the unique challenges that Black women face when it comes to understanding, diagnosing, and treating endometriosis. And it's a chronic condition that affects millions, but for Black women, you throw in racial bias, a delay in being diagnosed, and inadequate care, and it can often make that journey even more difficult. So tonight, we're going to explore the symptoms, treatment options, and ways that you can advocate for yourself. So let me introduce you to our panel tonight. And you've seen her before over on Celebration, Dr. Latasha Murphy. She is from the Gynecology Center at Mercy Medical Center in Baltimore, Maryland. Hello, Dr. Murphy.
Hello, good evening.
Good to see you again.
You as well. Thanks for having me.
We've got Dr. Ashonda St. John. She's a former chair. I'm going to mess this up. She's at OBGYN at Health Alliance Hospitals, a member of WMC Health. Welcome.
Thank you so much. Thank you for having me once again.
And then we've got Janelle Connor. She is a patient advocate.
Hi. Thank you for having me.
Thank you for joining. And then we've got Allison Scrutchins, also a patient advocate, joining us tonight.
Good evening. Good evening. I have my yellow on as well.
Yes. It is great to see all of you. And again, for the audience, please, drop any questions that you have as we go through the evening, and I'll try to make sure we can answer some of those. So let's just start off with the obvious question. Dr. Murphy, what is endometriosis and how does it affect the body? And please, if anyone else wants to jump in as I'm asking questions, feel free. We're very informal here.
So endometriosis is a condition where the uterine lining tissue finds its way completely outside of the uterus. In most cases, it's going to cause things like very painful cycles, but sometimes patients can have pain that's even outside of their cycle, around ovulation, during intercourse, or honestly, it can get bad enough where patients have pain every single day. But primarily, it causes inflammation, and that inflammation can have an effect on other parts of the body as well, and not just pelvic pain, but can cause some GI symptoms, can also cause people to feel bloated and what we call endobelly, like people get extremely bloated where they're having to change different clothing that they wear around their cycles because of it.
Okay, thank you. Dr. St. John, what are some of the other common symptoms of endometriosis? Because, I know a lot of people, like I was one that dealt with fibroids. And it felt like some of the symptoms that, my friends or family had with endo, if they were similar. So can you talk a little bit about those symptoms?
Well, in particular, because you have some of the tissue that normally lines the womb outside of the womb. So you can have inflammation, you can have pain, you can have anything that mimics your cycle that you would have in your uterus outside of your uterus. Typically, people will complain of fatigue. They'll have chronic pelvic pain. They can have pain with defecation and pain with urination. So, often with fibroids, because that tumor is pressing on the bladder or pressing on the rectum, that can cause pain or even difficulty. That can happen as well. And often what happens with endometriosis, besides having scar tissue outside of the uterus in your abdomen, that can also cause bowel obstruction. So it can cause you difficulty vomiting. What it can also do is, develop areas that are close to your womb that can really be positional. So that can cause pain with sexual intercourse, or even kind of the decline of or desire for intimacy. It can also render someone infertile, depending on the proximity to their fallopian tubes. So it is not an easy journey. It's one that is long and difficult. It typically starts in your early 20s, but it can start as soon as you start menstrual cycles. So it is something that is very distinctive, that kind of sometimes renders patients arrival in the emergency room every month because of this debilitating pain.
Wow. So, and just I just know from dealing with a family member that had this, but for those watching that may not realize this, so some may ask, well, okay, so I go for my annual exam. Why can't they find it then? Can y'all explain that? Why you can't? That's not the easiest way to find it.
Sure.
Yeah, Dr. Murphy.
Unfortunately, endometriosis they're not very large implants sometimes, right? So it's not something that you can always feel. It's not a tumor like a fibroid, right?
Mm-hmm.
And so in a lot of cases, even if you did pelvic imaging, like an ultrasound or an MRI, you may not be able to see it just because of how small these implants can be in the pelvis. So it's really difficult on exam sometimes to feel these areas, especially if, like I said, you don't have these deeply infiltrated areas that are maybe causing, bowel obstruction, like Dr. St. John was talking about earlier, or something like, a big ovarian cyst with the endometrioma, which is basically endometriosis fluid that increases the size of the ovaries. That's not the case for everyone who has endometriosis. So it can be difficult to palpate on exam. It has to be something that the provider or the patient even is thinking about in order to actually go looking for the diagnosis.
And doctors, let me know if I'm wrong, but 5 years ago, when I first got diagnosed, I was told that the only true way to confirm endometriosis was through surgery.
Mm-hmm.
Yes.
Research.
Yes, it's a tissue diagnosis, but you can absolutely suspect it and have a clinical inclination that that's what the patient is dealing with without having to put them through surgery to start with.
Yeah. And that was, for me, I think that's so important, is a transvaginal ultrasound for me personally in my story, because my mom had fibroids when I was growing up and I always had really painful periods. So she was insistent. She was like, you have to have fibroids, just get it checked out. And right before I knew I wanted to have a baby, and I knew I was about to start my fertility journey in my early to mid 30s, I had my first transvaginal ultrasound and they said, well, you do have 2 fibroids, but you have something else going on too. And I'm like, what? And they're like, you have endometriomas on your ovary, to Dr. Murphy's point, on your ovary. So mine were easily detected, unlike, unfortunately, a lot of other stories. And so then once they detected them, to Allison's point, they said, we can't confirm, but we're pretty sure that's, until you have surgery, we can't confirm, but we're pretty sure you have endometriosis.
Yeah. Unfortunately, the way that we kind of look at endometriosis, because it requires surgery, so it actually requires sampling of the tissue and a histologic evaluation, which is done by a pathologist to confirm it is in fact endometriosis. And so until that is done, typically we use a term called a diagnosis of exclusion. So we've excluded everything else. And again, often it's not seen in imaging. So you were very fortunate that they were able to pick it up. Often the cysts that accompany endometriosis, which are called endometriomas, we may just see those as cysts on a CAT scan or an ultrasound. It is in fact, when we do the surgery and we see these cysts, they actually look like chocolate cysts. And if they open up, it looks like dark chocolate. Like it literally looks like that. Often in the medical practice, a lot of our kind of descriptive terms are based on food. So we call it a chocolate cyst. But one of the things that is so difficult is that sometimes people don't want to have surgery. And, I started, I've been an OBGYN for 27 years. So back in those days, we didn't have laparoscopic surgery or minimally invasive surgery. So people did not want a large incision, right, on their bellies and have operative surgery to find out what is going on. And so that sometimes can be defeating for the patients because they want to arrive at what's happening so that we can go towards a cure or at least treat the symptoms. And that is kind of the most frustrating part of our patients, because number one, they want to find a doctor that listens, a provider that listens, wants to hear them out, but also who's going to do everything to kind of arrive at what's happening and kind of look at solutions and measures that will return their quality of life.
Thank you. And since I want to hear more from Allison and Janelle about their stories as well. Allison, can you share your story about when you were diagnosed?
Well, my diagnosis story, I feel like it was at least 15 years too late. I definitely was one of those children who, from the onset of my menstrual, was laying on the couch and they were like, get her a ginger ale, because y'all know they said that made everything better. Um, and it was very painful, you know. And for me, I believe that it took a Black doctor to actually diagnose me, which I'm very grateful for her. And I went and got a second opinion from another Black woman doctor, and she said, you know what, Allison, I've been seeing you for a long time. I think that may be what's wrong with you. And so my biggest symptoms are the pelvic pain. The pelvic pain is excruciating to the point where I'm laid out on the floor every month. And for me, it's not every month. I'm a 21-dayer. So I wish I had 28 days, but every 21 days, like clockwork, is coming back and the pain is accompanying it. And now it's turned into the pelvic pain, the fatigue. So many things are changing with my body as I age. And I am constantly trying to go to so many different doctors to get answers, because the doctor that diagnosed me actually did do a laparoscopic procedure. And the advice that I would give to anybody who is dealing with this and trying to get answers is to please find a specialist, because the specialist can actually get you some true answers and hopefully provide you with less pain. I appreciate the doctor that diagnosed me, but when she cut me, that's all she could do was diagnose me, because she wasn't a specialist. So therefore, she was not able to remove the scar tissue that she saw was present on the left side of my uterus. And that is where I'm always in pain, on the left side of my uterus. So we saw the scar tissue that was present. She couldn't remove it because she wasn't a specialist. So I technically got the diagnosis, but let's take it a step further and talk about how my surgery notes were incorrect. And they said that there was no endometriosis seen, even though she printed out the scar tissue picture, showed it to me, and the surgery notes never really got updated. So now when I finally got to this amazing specialist who's all the way in Skokie, Illinois, about an hour from Chicago, he's like, your surgery notes don't say anything. And I'm like, what? You know, I have the picture, you know, I have this, I have that. This is what they told me. And so now I'm dealing with him believing me. He 100% believes me. He's amazing. His name is Dr. Frank Tu. If you Google endometriosis research, his name is there a lot. And so he 100% believes me, but he's just saying that he didn't have the confirmation from the surgery notes. So now I'm actually April 4th preparing for my second laparoscopic. And yes, we just left the doctor's appointment. Today was my pre-op, and I took my husband, y'all, because he was like, I do not want you to have surgery again. And what Dr. St. John point was that surgery is scary, yes, but if it's necessary to give you the relief that you need to do what's best for your quality of life. And when I say I'm tired of being in pain, I'm tired of being in pain. I've been through all the drugs you can think of, the tramadols, the codeines. I'm currently taking oxycodone, and I have to take oxycodone with ibuprofen every month in order to feel relief. And I still am pain. So for me, the biggest thing of my story is I have the pelvic pain issue, and my pelvic pain is very serious. So that's what I'm trying to find relief from. And I've been told great things about, if you get a good specialist for this laparoscopic, that they can remove the tissue, you heal within 6 weeks, you can even get pregnant within 2 months. So that is what my story is. And I'm trying to give birth because I don't have any children just yet. And being able to find the right doctor is what's most important. But more specifically, look for that specialist that can actually listen to your needs. They're doing the research. This is their field. This is their passion. So they really want to heal you. And so I'm on the journey of healing my endometriosis, and I believe that it can be done.
Thank you for sharing that. I think I'm still stuck on the surgery notes, though, not having all of the info. It gave me a flashback, but that's for another day. Janelle, do you want to share more to your story? Because you were, you know, it sounds like yours was kind of found. That's not what they were really looking for initially.
No. And Allison, my heart, the pain, I'm sorry. I just can't. Where to start? I'm older. So my story starts probably, I would say, let's do the abbreviated version. I always had painful periods. That's all I remember was painful periods. And I just took it as, oh, this is just my life. I'm going to have painful periods. I just would take 800 milligrams of Advil to get through the first couple of days of my period. And then I was typically okay. And then after I had the transvaginal ultrasound in my early 30s, and they determined that it was probably the chocolate cyst, they weren't sure if it would impact my fertility. Long story short, it didn't. I was able to get pregnant naturally in my mid-30s. I got very lucky. I know during pregnancy, and doctors, correct me if I'm wrong, fibroids, I'll get this right. Fibroids can get bigger and endometriosis can get smaller. Is that right?
Yes.
Typically? So I didn't have any complications with my 2 fibroids that I had and the endometriosis during pregnancy. Postpartum, I would say 3 years after I had my daughter, one day I was just in our house and I keeled over in pain and I fell to the ground and I could not get up. And I did not know what was happening. I obviously knew I had endometriosis, but I didn't know where I was with it at that point. And when I went in, I live in Los Angeles. So I am so grateful because I am so connected to some of the best doctors and specialists, I believe, in the entire world. And I had the right people. I was able to go to doctors who said, okay, well, we told you you had endometriosis. What more do you want us to tell you? You have to have the surgery. And I was afraid. I had never had surgery before in my life and I didn't want to have it. But I also knew I didn't want to live like that. And I couldn't live like that. I had to take care of my daughter. It's like I couldn't just, fall to the ground every month. So I went in and did my pre-op during COVID. Actually, I didn't go in. It was done virtually with Dr. Kelly Wright at Cedars. And she was just phenomenal. And as soon as I met her, I knew, okay, this is the person and she's going to be able to help me. And I was just convinced because I just knew I couldn't live the other way. And I had my surgery 3 years ago in May. This coming May will be 3 years. And I'm happy to report that she put me on Yasmin birth control kind of indefinitely to take me through perimenopause and then whatever I need, for hormones down the line. But I take the pill continuously and I don't get a period anymore. And I'm on the other side. I'm happily on the other side.
Yay.
So there's hope. There's definitely hope.
Thank you for sharing that. And I meant to mention that you're a Cedars-Sinai patient. So thank you, Janelle, for sharing your story.
Oh, absolutely.
Yeah, that's great that you're on the other side. Which brings me to the question of Dr. St. John, how does endometriosis impact fertility and the just overall reproductive health?
Yeah. So before I answer that, I really want to lift up what Allison said, about finding specialists, right? And so we have so many innovations in medicine. And one of the biggest innovations we have is minimally invasive surgery or even robotic surgery. And so this is doing surgery where we make very small incisions, right, throughout the abdomen. And so it's less invasive, less chance of scar tissue. And again, sometimes it is the specialists who are experts at this. And so really kind of adhering to what Allison said about finding someone where this is their level, their scope of practice, but also their level of expertise, because that is the difference between someone who can help you and someone who can make your life better. Because again, one of the biggest things that my patients will say is that I am on the floor in the bathroom every month and I cannot move, right? And so these patients cannot go to work, they cannot go to school. If they have families, they cannot take care of their families. This can be debilitating. So when we think about that, we also have to think about the impact of what this endometrial tissue that is outside of the womb, what it does to your body. Well, it can cause scar tissue. And if that scar tissue is close to your fallopian tubes, then it can impact your ability to get pregnant. I've had patients where they didn't even know they had endometriosis. And what's difficult about this is everyone has a different pain threshold. We know some people, they get their period, they don't even blink an eye. We have some people, they're like, the day before, I'm taking the Motrin, the Advil, I'm getting ready, because again, pain is different for every different person. And so when we think about that, I've had patients who their pain history is unremarkable. And then I do a C-section to deliver their baby and they have stage 4 endometriosis. And I'm like, how did they get pregnant? Right? Because again, the pain threshold is different. And this is the part where we need to listen to our patients, but specifically listen to our Black patients. They are often unheard. We have weathering, we have social determinants of health. We have so many stressors that impact their health. But one of the biggest things is medical trauma and toxicity. So when we don't listen and we don't validate their lived experience, right? And if we don't encounter or we enter in shared decision making and allow our patients to be a part of the decisions that are made on their bodies, then we're not doing any justice for anyone. So again, it is the scar tissue, it's the proximity to the fallopian tubes that can impact and cause infertility. But I'm going to tell you, much more than all of that is finding a provider who doesn't listen to you, who doesn't validate your lived experience. If you are in pain, I believe you, right? Because we have often heard that, the patient is pain seeking or they love to go to the ER. Nobody wants to go. When I teach my residents and medical students, the most valued patient that I want to see is the patient that comes to the ER. I'm in New York City. Nobody wants to go to the ER. Nobody wants to wait 5 hours. So guess what? They've exhausted everything they could do at home. And they said, you know what? I'm going to go in there for 5 hours or whatever, because I am desperate at this point. So these are the most valued patients that you want to see. These are the ones you want to help the most. And so getting that diagnosis, again, Allison, it breaks my heart that your operative note had nothing about endometriosis.
Yeah.
This breaks my heart. This is what we talk about by not being heard, not being seen, not being valued. One of the things I teach is that for my residents and my medical students, every patient you see, you want to treat them like yourself, your mother, your sister, your daughter. Right? If we got that care, if we gave that care to our patients, it'd be a whole different world. You want the best, so your patient wants the best as well.
Dr. St. John, I am holding back tears. I am holding back tears because it's tough, it is really, really tough. And thank you for everything you said, because you go to the ER and the ER treats you the worst because they're like, oh, you just cramping, you just in pain, or for me, I didn't even get to say it. I'm in pain every 21 days and I'm in pain when I'm ovulating. I feel ovulation pain. I said, what in the world? How did this happen? So to hear that you're like, I want to see the ER patient. I just wish there was more doctors like you, because the ER patients, for us women dealing with endometriosis, I believe we're the most untreated, unheard, and nobody listens to us because they think, number one, Black women don't feel pain, and number two, it's just your menstrual, you'll be okay. But you don't understand the level of pain that I'm feeling. I feel like my insides are crawling, and so just to hear that from you makes me want to move to NYC and make you my doctor.
Yeah.
I think it goes back to slavery, right? If we can quickly talk about J. Marion Sims, who they want to call the father of gynecology. One of the things that he did in kind of really perfecting his surgical skill was experimenting on enslaved women.
With no
Without anesthesia.
No anesthesia. So we have the most three that we know about is Betsy, Lucy, and Anarcha. And Anarcha had over 30 surgeries with no anesthesia, sometimes multiple in one day. So we have been the guinea pigs. We do not want to be the guinea pigs. I never had a Black doctor, a Black female doctor growing up. So I understand when patients travel to see me. I understand what that means. I understand that type of pain that they have during ovulation, which is called middle smirts, and then also during their menstrual cycle. And to imagine having 21-day cycles, that's at least 3 times a month. that you are just, basically not available for anyone in your family because you are suffering through so much pain. So I think what we can do is uplift Black women and the Black experience and the lived experience, but also the misinformation, disinformation that we do not have pain, or our skin is thicker.
Mm.
No, it's not. I hurt just like everyone else.
The other thing I'm going to mention is, I often call endometriosis the invisible disease sometimes, right? I feel like, unfortunately, what ends up happening is like the healthcare system kind of forces endometriosis patients and Black endometriosis patients to convince them that there's something going on, right? And that's not your job as a patient, right? Your job is to say, there's something not right. I am telling you, and then it's the provider's job to figure out what that is and figure out how you're going to make it feel better in the shared decision making with that patient. Right? So I will agree with everyone else who has already said, I am so sorry that you're going through what you're going through and have gone through what you're going through, because it's not on you. It is not your job, right? Basically, healthcare is falling short, not giving you what you need when you have been asking for help for over 15 years.
And what the doctors are saying, oh, sorry, go ahead.
I just want to quickly just say one thing. I'm so sorry. Endometriosis can be hereditary. It runs in families. So what Janelle was talking about, having a mother who was very kind of homed in and say, look, we need to do ultrasound, we have to diagnose you, right? We know that fibroids are more prevalent in women of color, right? But also her endometriosis can be hereditary. So if mom, sister, aunts have it, there's nothing wrong with saying or requesting that I be evaluated for that, and that there is heightened sensitivity for the pain that one may endure. I'm so sorry, Janelle, I didn't mean to cut you off.
No, not at all. No, I was just going to go both of your points, doctors. I mean, the shared decision-making part, I always think of my doctor as my partner. And I think about finding a doctor the way you would dating someone. Like, you're not going to just get with anybody. Like, you need to find someone who, has these requirements, right? Have a list. I need them to make, sometimes doctors, I feel too, they have a lot of patients and they're just trying to get in and out, right? And you can understand that any job you do, sometimes you can't be fully present, but when somebody is paying attention to you, when someone is listening in a way that they are willing to come and arrive at a decision together, as opposed to just telling you what's happening. And for a long time, I kept a journal, and I thought that was really helpful, because sometimes doctors will even say, well, you should, if it was this, you'd be feeling that. And it's like, well, no, this is what happened on this day, and this is how I was feeling. And could we look into this other thing that it could possibly be? I mean, I think just coming from the position of you know your body better than anyone else, and your doctor is in partnership with you to figure out what's going on. So.
Absolutely. Yeah. This is so good. I'm like, I don't even want to interrupt with asking a question, because this is a great conversation. But I do want to make sure we talk about the treatments for endometriosis, because there isn't really necessarily a cure. Am I right? Or are there just kind of some treatments to help with it? Dr. Murphy, can you talk a little bit about the treatments?
Absolutely. So with endometriosis, one of the most important treatments would be excision, like the laparoscopy. Not only gives you a diagnosis, but it's also a treatment, right? It's removing the abnormal areas of tissue that are in places that it shouldn't be. But there are medications, like Janelle mentioned earlier, that after her surgery, she was placed on hormonal medication like birth control. And that's also something that can be done, because endometriosis, like I said, is endometrial or uterine lining tissue outside of the uterus. That tissue is hormonally responsive. So in addition to removing that, you can also try to minimize the triggering of that endometrial tissue by minimizing estrogen, which stimulates it to grow, right? So there's hormonal treatment, there's surgical treatment, and then it also can cause, like I said, chronic pelvic pain. Sometimes the pain is not just because there is an implant there, right? It's been an implant there for years upon years. There could be a neuropathic hypersensitivity to that as well. So doing sort of a well-rounded evaluation and treatment plan with treating the neuropathic potential pain with neuropathic pain as well, with different medications, not just hormonal. And the other thing, it's an inflammatory disorder as well. right? So there are certain things like just in everyday life that patients can do, like doing things like exercise, which help decrease inflammation, or yoga, things like that, that you can just sort of a holistic approach in trying to treat it. But I would say if you start looking things up on Google or whatever, you'll typically see surgery, hormonal treatments. There's these things called GnRH agonists or antagonists, things like Orlissa or Myfembree, which are the FDA-approved medication for endometriosis. Those are medications that essentially tell your body to stop making estrogen so that it's not continuing to stimulate the estrogen-dependent tissue.
Can I add something that I did personally, and it's all anecdotal? I say this because I don't want to guide anybody in any direction that might not work for them, but worked for me was, as Dr. Murphy was saying, the anti-inflammatory component, and it's taking a holistic approach through diet. There's certain foods that you can eat that help with inflammation in the body that can help. And I know that I truly believe this is how I ended up getting pregnant with endometriosis, was because I employed an anti-inflammatory diet. I also did acupuncture, which I firmly believe in. And a lot of insurance covers, people don't realize that a lot of insurance policies cover acupuncture. So look into that. Yeah. And I did do a couple of supplements. I'm not going to say what they were, but I think you should just look up whatever's out there that says it's anti-inflammatory. Do your research, because I found a few supplements to be very helpful.
Just to add on to what Janelle said, so if you actually look at endometriosis research studies, acupuncture is actually one of those things that are not sort of your traditional medications, right, that have been shown to help with endometriosis symptoms time and time again. So you're absolutely correct. Like, again, the holistic approach is not just medication, not just surgery, but there are other things that can decrease inflammation as well.
And I just want to jump on the bandwagon about acupuncture. Because I've done it and it has helped. Only problem with me is that it's not covered under my insurance. So to get it every time, it's like $100, $125, at least here in the Chicagoland area. But when I've had very intense bouts of pain and I can make it, it's helped. And then I also try to go like the week before my menstrual was coming and the pain was not as intense as it had been before that. So I definitely think acupuncture is a great treatment and option.
One of the options that I really discuss with my patients in terms of acupuncture, because it can be costly, is in New York, we have schools of acupuncture. They have discounted rates. So I have a lot of my patients and they get it done every week for $10 to $20 because they're in the school. So that's one thing you can explore as well.
Nice.
Okay, I'm writing that down because I love going to acupuncture, but it is expensive. My insurance doesn't cover it either, but it is. I'm going to look that up. I do see a comment about, hysterectomy is brought up a lot sometimes when a patient says they have endometriosis, but someone's asking, is there hope for patients that may have stage 4 endometriosis and adenomyosis and or fibroids? Can they carry a pregnancy full term, or should they go ahead with the doctor's recommendation of a hysterectomy? Is there,
this personal belief is that there's always hope.
Yeah.
There's always hope. Yeah. Right. And so we cannot predict what's going to happen to you based on what happened to someone else. Right. And again, when we talk about pain threshold, when we talk about, again, I had someone with the most severe stage 4 endometriosis I have ever seen. I can usually do a C-section in 15, 20 minutes. And I was in there for 2 hours and they were like, are you okay? But again, we were going to do this and save her uterus. And that's just what it was going to be. So I say there's always hope. I think that miracles happen. Yeah. And so again, I think there's science. And then there's a higher being and a higher calling. And so, sometimes that's the route you have to take. And you have to have faith of a mustard seed in yellow. So I think you have to think about that as well. I think also when we were talking about the selection of providers, you want someone who talks with you, not at you. And that's very important. And I think someone who's also receptive to non-traditional medical pathways, right? Because I found the acupuncture school for my patients because they were like, I can't afford this, but I know it works. And I said, well, let me do a little research. You know, they have cosmetology schools that do your hair for a discounted rate or facials. And then we found the acupuncture school. We have several in Chinatown here in New York. And I have patients who go and it's $10, $20 and it's life changing. So there's always hope. You know, you just sometimes have to explore and find the possibilities.
Thank you. So can we talk about like the myth that a hysterectomy will cure the endometriosis? Can we talk about that? Because I know I've seen, you know, even just hearing people talk about it on social media is, you know, does that pain go away? Is it still going to stick around despite that hysterectomy? Like what happens with that, Dr. Murphy?
Yeah, sure. So I would say in the majority of patients, if it is done correctly, yes, the pain will go away. But it, you know, medicine is very patient dependent, right? So I can't say in 100% of cases that that's going to be the case. You get a hysterectomy and everything, it's going to be fine. But the thing that I think is most important is to know that there is a chance that pain can continue after a hysterectomy. Also, there are sometimes that patients will have a hysterectomy and say, oh, I think my pain will go away because I've had the hysterectomy, but that's because when they had their hysterectomy, they left the ovaries behind, didn't have a surgical treatment of endometriosis at the same time. So you haven't really done anything but take out a patient's, you know, reproductive system, right? And you still allowed, you know, the implants to be there, still have the ovaries that are producing estrogen that's going to trigger that tissue. Right? So it just has to be done in the correct way. But again, we talked about before, there's also a component of chronic pelvic pain that comes along with endometriosis, and that doesn't necessarily go away completely for everyone, right? What you have done when you remove the uterus is, we believe in most cases that endometriosis comes from retrograde menstruation. When a patient is menstruating, a lot of times the blood is going to go on a pad or tampon or cup or whatever the patient is using, but it also backflows through the fallopian tubes and spills into the pelvis, and that's where a lot of that uterine tissue gets into. So if you remove the source of the uterine lining, which is the uterus, right, then the hope is that if you take that out, you remove the source of that abnormal uterine tissue, and then you've also excised the endometrial implants that are already in the pelvis, then you can hopefully give that patient, you know, sort of a pain-free future after hysterectomy. Not guaranteed, but that is the theory behind it.
Oh, okay. That makes so much sense. So what about for those that, you know, talking about these surgeries and then say the scar tissue or the more of the, what were you calling them? The chocolate cyst and all the things they grow back or the scar tissue. And then there's another surgery. So how many surgeries can one possibly have to continue to go in and remove this lining? Because that seems like a lot.
So it's not surgery to remove the line. The endometrial implants can be anywhere in the pelvis. So it could be on the appendix, it could be on the bladder, it could be on the colon, it could be on the omentum. And that's the part that's tricky, right? And so again, taking out the uterus is not always curative. It doesn't dissipate the pain. And that's the part that's so challenging. And so when I hear of patients that have been like really pushed towards having a hysterectomy and then they have the pain, you know, that's the worst feeling in the world because I did what you said and now look what happened, right? And so that's the part that's so difficult because also when we're looking inside, there may be kind of implants that are hiding under something else. We don't see them, we don't remove them. And then you still have pain because they were there and now you have to have another surgery. And remember, with each surgery, you can have more and more scar tissue just from the surgery. So this part is the difficult part. And this is why we have to uplift patients who suffer with endometriosis because it is not an easy path. And so when we talk about having an abundance of empathy and compassion and a generosity of spirit, right? And this is why people will try every and anything because again, surgery is not always the answer. And this is the part that's most difficult.
Well, I want to talk about the mental health aspect because for a second, I've seen it firsthand. It's can cause a lot of depression. Gosh, I'm trying not to cry. It can cause, it can do a number on your mental health. So I'm just curious with Janelle and Allison, how it affected your mental health. Janelle, I'll start with you.
I think I don't know really how to answer that question because I don't know that it had such an impact that it was any more noticeable than anything else that might have been causing, anxiety or depression. I was never given a clinical diagnosis as a result of the endometriosis, but I would say I think there is some anxiety, knowing every time, as Allison was saying, her cycle is coming, right? And like mine was to almost the hour. Like I could predict exactly when I was, and I knew which day was going to be hardest and things like that. So I think there's a lot of mental gymnastics that I had to do just to sort of exist normally in the world and in a way that I was still functional, and all the things I had to prepare. And I will say now that I don't have that as a part of my life, it's definitely a relief. But I can't say that I had a direct correlation between endometriosis and my mental health.
Okay. Allison, how about you?
Well, I foot the bill for both of us, Janelle, because I don't even know where to begin. Beyond depressing. I don't even know if beyond depressing is a word, but it needs to be in the dictionary because for me, I've been in pain since I was 15. I had my first hospital visit when I was 15. I passed out from being in so much pain. They said I had an ovarian cyst, a UTI, and gastritis, which I now think was always endometriosis. And so since I was 15, I've been in the hospital at least once every year. I'm 35 now. So that is 20 years of in and out of the hospital, being in pain every 21 days. You finally get the diagnosis, but you just got a diagnosis. You still don't have a solution because there's no solution for endometriosis. So that is why I want to do things like this to bring awareness to it, especially in Black women, because it is depressing. And for anybody that's dealing with it, my prayers go to you. We will make it through. But at the end of the day, you can't control your emotions, and being a woman is hard. So, 1 week you feel like you're okay. The next week you got PMS. The next week you're menstruating. The week after that you ovulating. Like, when am I ever able to just be one person and okay? So for me, it's very depressing. I'm crying every time I'm in pain because I'm just so tired of being in pain. The anxiety increases. You think you will never find somebody who can deal with your pain, somebody who can love you through your pain, but there's hope, ladies. I just got married, so there's hope. And so, I say to what Dr. St. John said, and to the lady who has the stage 4 considering a hysterectomy, if you want a baby, have hope and have faith that you can have your baby. The sad part about it is that the hysterectomy is the automatic solution for women with endometriosis because they don't know what else to do for us. So most doctors are immediately offering a hysterectomy. And so I still got hope. I'm mid-30s, still trying to get there. And so I just read a story about a woman 6 weeks after she recovered from her procedure, she was pregnant 2 months later. And so everybody can have a testimony. Everybody can have a miracle. Do some holistic things like Janelle was saying, eat right, get you some good herbs, cleanse your body. If you detox and prepare your body, I believe that you can have a successful pregnancy. So in case you needed that second band of hope in the comments, that's for you. But I just think we got to have hope because life is hard. Life is hard for everybody. Everybody's dealing with something. And sadly, endometriosis can kick your butt if you allow it. But once you make it through that pain, just keep striving towards knowing that you can have some healing for yourself one day.
Thank you for that. It reminds me of a book. I think it was Tia Mowry, the actress, her book when she found out she had endometriosis. And it's a cookbook. And I don't know if anybody wants to check it out in the comments. I can't think of the name of it, but it's a cookbook with some recipes that she used, and it's very plant-based, but she did that to prepare her body for pregnancy while also, dealing with endometriosis. So, yes, thank you, Allison. Thank you for that uplifting message, like that hopefully, the person in the comment that I haven't seen her say anything yet, but she did ask where she could get a consultation with Dr. Murphy or Dr. St. John.
Yay.
Are the doctors, are the minimally invasive laparoscopic surgeons, they're very few and far between for this. Oh no, they're out there like that?
Yeah,
Okay.
I am actually. I probably should have put that under there, but I am a fellowship trained minimally invasive gynecologic surgeon. This is what I do day in and day out. I do endometrial surgeries all the time. In fact, I have one coming up tomorrow who is a stage 4 endometriosis patient. This will be her second surgery. Her first one was probably about 5 years ago. And she was one of those people that was like, oh, I just have like some back pain. It was very uncomfortable for her. Happened to do an ultrasound. She had this 10-centimeter endometrioma and then endometriosis everywhere in the pelvis. I mean, like from the diaphragm down to the pelvic floor.
Oh no.
So we went and cleared things up, and for 5 years she's been doing great. The only reason she's back now, she's getting married soon. She's planning to have a baby. We're going in to try to just clean things up, decrease the inflammation that's in the pelvis, and sort of get her ready for pregnancy upcoming. So like you said, Allison, there's definitely some hope, right? Like stage 4 endo does not mean the end of the fertility journey, doesn't mean the end of a happy, intimate life or anything like that. But yes, this is what there are us out there.
Yeah, thank you. So we talked a lot about finding a specialist, finding doctors that really listen, doctors that care, and making sure you advocate for yourself. So what advice do each of you have for how Black women can advocate for themselves so that they can get that proper care? If they're trying to figure out, okay, what do I need to be asking? What, those types of things, like what type of specialist am I looking for? Can you give them some guidance and advice? Dr. St. John, I'm going to start with you.
Well, I would say, in this age of the internet and Google, I would say do your research, right? I think you specifically, like Allison said, if you want and need and should desire a specialist in endometriosis, then you can find one. Now, it may be difficult if they don't accept your insurance or their location, but remember, we utilize the telemedicine platform a lot now. And so there are options where you can get a virtual appointment and have a consultation. I would also say, speak with your friends. There are communities, there's Facebook groups. Typically when someone has a good experience, they share because they want someone else to have a good experience. And then, I say is go with your gut. Sometimes you can meet someone within 5 seconds, you already have it down packed. You can see their lack of or their abundance of professionalism, right? Are they listening? Is there eye contact, right? Are they gonna elevate my lived experience? I think one of the other things I just want to comment quickly about what you said about the intersection of mental health and endometriosis. Mm-hmm. What happens often is with patients with chronic pelvic pain, they're often sent to a mental health specialist or a psychiatrist, right? Mm-hmm. Because of that misdiagnosis or that they're not being believed, right? Or even returning to the ER every month because they're in debilitating pain and they're not being believed, or they're having a panic attack, or they're drug seeking. So again, there is an intersection that exists. And so what I say is pick your team, pick your doctor, be intentional, be purposeful, and make sure it's a match. Don't pick them just because that's who you got an appointment with. We're in the day and age where you can be selective, and you should be.
Yeah.
Mm-hmm. Your health is on the line.
Yeah, and I tell my patients all the time, I'm very okay with if you want to go and have a second opinion and talk to someone else. You need to make sure that whatever decision that you're making for your health is the right one for you. Just because I say something or some other doctor says that that's what you should do doesn't necessarily mean that you have to take that at face value and go down that road. Right. So I would say to any person who is considering, going under the knife with someone, right? Like you're putting yourself in a very vulnerable position and you're basically saying, hey, take care of me while I can't do anything about it, right? You're asleep. So you want to make sure that you're very comfortable with that person who's going to be taking care of this with you, because it's a long haul. When I first see patients for endometriosis consultation, I tell them this is not a sprint, it's a marathon, right? Like we have to figure out how we're going to increase your quality of life for a long time to come. This is not a one and done situation, right? So if the person that you are having a consultation with or you've been seeing is not listening to you, you don't feel like you're heard and you're trying to convince them that they have to do something for you, that's not the person that you need to be seeing.
Yes,
absolutely. Janelle.
I'll double down. I said date, date until you find the right match. Have a list of requirements. Don't settle for anything less than you deserve. The listening component. I really do feel like journaling was really helpful for me because I feel like sometimes I'll get there and there's so many things racing through my mind about, wait, when did this happen? And I kept a journal for, I would say, a year when I would say it was about a year. And then I would be able to take that in and that would help me feel more comfortable and more confident advocating for myself. What else? Just having a partnership with your doctor, I think, is just the most important thing. Finding that person who really values you as their patient and really wants to help you.
Thank you. Allison.
I think Google is your best friend. Right now we can Google anything and anybody, and we can look up a lot of things. And so when I was in the thick of trying to learn endometriosis, figure it out, see what the research is about, which is not enough of. So I really hope that one day we can get to a point where there's enough research on it. And so when I was researching, my doctor, my current specialist, I kept seeing his name. And so I was like, man, who is this guy Frank too? Let me look him up, and come to find out he was right in Skokie. And so for me, I believe it was divine, because when I went to get that second opinion from the other Black doctor, she said, I want you to go see Frank too. I trust him with my life. And so if this amazing Black doctor says she trusts him with her life, I knew he was good. And so I knew that was my second sign for him. That was my second sign. And so my third sign was when I went to go see him, everything I told him, I was like, well, sometimes I'm nauseous. Sometimes my back hurts. Sometimes everything I told him, if it wasn't related to endometriosis, he was like, okay, I want you to go see this hormone doctor. I want you to go see this dermatologist. I want you to go see this nerve doctor. It was constantly like, I'm going to do what I can do for you. But the things that are outside of my warehouse, I am going to send you to a specialist or a doctor just as good that I highly recommend. And so for those looking for a good doctor, I would say, while you're dating, as Janelle would say, while you're dating them, give them, 3 to 5 things that are going on with you and see if they listen to each and every one.
That's good, Allison.
Every single thing that's going on with you needs to be addressed. But you have the doctors that are like in the ER, they're just excluding what's not wrong with you, but they're not really trying to get to the point of what is going on with you. So choose 3 to 5 things that are going on with you. And I will see if that doctor is really caring about addressing each and every one to assist you to get the healing that you deserve.
Thank you. So as we wrap up, this conversation's been so good. What final advice do you have for Black women who, and Allison kind of answered this already, but what final advice do you have for Black women who suspect that they may have endometriosis and they're really struggling to get answers? And we could kind of add on to this, what's a key takeaway from this entire conversation? So Dr. Murphy, I'm going to start with you.
Okay. So I would say, if you think that you have endometriosis, one, don't let someone tell you that it's in your head. And so make sure that you are an advocate for yourself. If someone is saying, no, I don't see anything on imaging, you can't have that, it's just your cycle, you want to go find someone else, right? So just make sure you're not settling. And then the other thing is, I find that we ourselves as Black women are sometimes kind of hard on ourselves as well, in terms of, oh, well, this is what my cycle has always been. So it's just my cycle, right? And that sometimes kind of hinders what people say when they go into the provider for the first time, right? So if you're having to take time off of work, leave work early, take a bunch of medication to get through the day. That is not just a normal cycle. And you should be talking to your providers about it, right? If you have to alter your day-to-day activities just to get through the day, to get through your cycle, there's something not right about that, and you need to get to the bottom of it.
That's good.
Thank you. Dr. St. John.
What I would say is you deserve to be believed. You deserve to be heard. You deserve to be seen. You deserve to exist without pain.
I love that. Janelle.
Can you just remind me of the question so I can make sure I'm answering correctly?
Yeah.
Doctors have
Just
said
what final advice? I know, yeah. What final advice or key takeaway do you have for Black women that are struggling to get answers that they may not have been, that they suspect they have endometriosis?
Yeah, just believe you know yourself better. You know your body better than anybody else on the planet. Full stop. So just keep going until, you find someone who takes that seriously, what you're saying. And I don't really have anything additive beyond what the doctors already said. And take care of yourself to the best of your ability. I really believe as much as we can take care of ourselves before we even get to the doctor's office, in terms of just how you're eating and you're exercising and all the holistic things you can be doing. If that is a resource for you, do it.
Thank you. Allison.
So, Dr. St. John, she gonna have to buy me a box of Kleenex because she just did it for me. And I think that's the biggest takeaway for me is that you deserve to not be in pain. Like that's the drop the mic. That's why she didn't say nothing else as she said that. She just dropped the mic because if you suspect yourself to have endometriosis, I would just say your menstruals are not supposed to be that painful. If your menstruals, to what Dr. Murphy said, are forcing you to be laid out every month, forcing you to take so much medicine, forcing you to call off work, listen to your body and know it's not just how my menstruals always been. And know just because my mama deal with it, it's not meant for me to deal with it too. It passed my mom. My mother has never had pain ever, but it was my grandmother had the worst. So, it's really about understanding that you are not meant to be in that type of pain, to listen to your body and to go get you some help so that you're not dealing with other things later because you left it untreated. And we don't deserve to be in pain and we deserve to be healed.
Yeah, I want to thank all of you for coming on tonight and talking about such an important topic. I do believe that you have uplifted, given people in the comments and those watching some hope, and I am so grateful for that. Yes, Dr. St. John owes us some tissues. But thank you all for coming and being transparent, sharing your stories, sharing your knowledge. I do see some people saying they are going to check out their insurance and see where they can get some help, because I do believe this absolutely opened their eyes. So thank you for that. For more information on endometriosis, you can head over to blackdoctor.org. There's articles and resources there. And again, I want to thank you for joining tonight. And I do have an endometriosis show next Wednesday on Celebration. So, we'll have more content then as well if you guys want to check that out. So thank you again and have a wonderful night.
Thank you.